So I'm the medical director of surgical weight loss at St. Francis Hospital here in Memphis. I've been in Memphis at St. Francis since 2010. This is where I've been my entire career, taking care of patients at St. Francis here in the Mid-South in Memphis and from the surrounding area.
Why is it that diets don't work? You know, you have people that yo-yo. They lose weight and then they're happy, and you see them again. They always say, well, I lost this weight, but I've gained 20 back. What's the problem there?
So I do these informational seminars at the hospital every couple weeks. You know, 100 patients, 100 potential patients, 150 patients. You came to one.
Yes.
You got to experience it. It's a fantastic forum to get a lot of these questions answered. They talk about them on my website at St. Francis Hospital. But essentially, almost every patient that I operate on or treat has been on a diet. And they ask that exact question. I've been on the Ornish diet, the Atkins diet, the Zone diet, the South Beach diet, the Grapefruit diet. They've been on Weight Watchers. They've been on Jenny Craig. And we're talking about thousands of dollars and hundreds of hours spent dieting and on these food programs and all these reading these books and these manuals and all these crazy workouts. The problem is when you go on a diet, and if your BMI is over 35, there's an inherent setup for you to fail. All of the studies show, like I said before, once your BMI is 35, you really need to change the actual metabolism of your body if you're really going to have significant weight loss.
Okay.
So when you go on a diet, what you're doing is you're essentially decreasing the amount of calories that you're taking in. So when you do that, your body doesn't like that. Now, you can do that for a while. You can do it for 6 months, 8 months, a year, maybe longer. But eventually, the hormones that control your metabolism, your satiety, your feeling of fullness, and your appetite. In particular, appetite hormone is ghrelin. A lot of people have heard of that. They'll Google it. They'll ask me about it. The satiety hormones are peptide YY and CCK. The metabolism hormones are leptin and melanocortin. All these hormones, when you go on a diet, work in the opposite that you want. You reduce your calories, what happens? Your appetite goes up,
Yes.
right? But you want it to go down.
Right.
The feeling of fullness, your satiety, it goes down, but you want it to go up. You want to feel full, but you don't. Your metabolism that you're trying to rev up to burn calories, it slows down. So your body kind of goes into this, hibernation state. It starts saving the calories, thinking that it's starving. So all the hormones are fighting all the things you're trying to do. So eventually what happens? You come right back to where you were, to the same weight you started the diet at, if not more. Some patients go on a diet, they lose 30, 40, 50 pounds, and before you know it, a year or two later, they're back up 60 pounds where they were before. So that's the cycle that surgery can break. The surgery that I perform actually changes your physiology. It changes your metabolism. It changes your nutrient utilization. It changes your energy balance. So, it's much more than just saying, hey, Mr. and Mrs. Smith, why don't you just eat less and exercise more? If you need to lose 100 pounds, there's so much more to it than that.
Okay.
We know that obesity is such a complex disease. Just to give a little background on it, there's essentially 6 components that work together to kind of make a person obese. One of the components is genetics. We can't change that. That is your genetic makeup. Another of the 2 components we have control over are your environment and your behaviors. Those things can be modified. There's clearly a psychiatric component. The 2 components that I work on is the metabolism and the physiology. And I can change the gut hormones, so to speak, through surgery. I can trick the body into doing the reverse of what I just talked about. When you eat a meal, I can make you feel fuller quicker. I can make your appetite kind of go down and increase your metabolism, which is what we're trying to do in the first place. So substantial weight loss can occur for someone with a BMI over 35 if they have the right surgery.
So I'm the medical director of surgical weight loss at St. Francis Hospital here in Memphis. I've been in Memphis at St. Francis since 2010. This is where I've been my entire career, taking care of patients at St. Francis here in the Mid-South in Memphis and from the surrounding area.